Good.
We'll take questions now.
Yes, please.
Thank you so much. Just listening to your voice, it's therapeutic. I was wondering, how do you, being a Baha'i and having Baha'i patients, how do you disassociate, or how do you make that separation, not get emotional, given your, personal experiences?
Not easy. Wonderful question, not easy. Yeah, as you said, as you saw me, I got even emotional now, not being in front of a patient. I did a research interviewing some ladies, Baha'is and non-Baha'is, 25 non-Baha'is and 25 Baha'is, and my idea, there was a topic for that research. It was a big empirical research. And that, in fact, was one of the weaknesses that I mentioned at the end of my research. When we come through what are the weaknesses and what are the strengths, I really thought that if this research was done by a non-Baha'i, the results could be perhaps better. Or the effect could be perhaps better, because I had a sense that I can get involved emotionally. But it's me. How can you not do? Right. Truly, yes, that's right. Not only as a clinician, you can, I'm not saying that I will be biased, no, because it has no meaning when you are trying to help a human being. But when a Baha'i is sitting there and is telling me about the problem she is going through, I can connect more, I can relate more, I can see myself into it more, and then that guided imagery takes me to so many of my friends who are still suffering. So I guess at that moment sometimes I decide to change my place and give my chair to the patient and sit on the other side. That can happen too. You're right, yes. Not easy at all. Not as a clinician and not as a researcher.
I believe that suffering happened because of the ignorance of the people, and also there is two types of suffering. One is physical and one is psychological. Physical happens because even when the child is born and they hit him on the back, they start crying and start breathing. So it happens during the lifespan and it doesn't stop. And also psychological suffering happens also the same way. But as I said, the best way of stopping it is the raising level of the people's thought and educating them.
Correct.
And also the patient or the individual is half of the equation. The other half is the people who are in contact with the person.
Right.
And also I believe if they, I know sometimes it costs $300-400 for the patient to pay, but I believe the psychologist is talk with the other half of the equation. Sometimes the treatment goes a lot faster.
Right. You mean that the loved ones, the close ones to the patients also needs to be educated?
See, half of the equation can be close one, half of the equation can be people who are in contact with the person.
Mm-hmm.
And if you contact with them and tell them that we don't charge you, we just want to...
But I'm just calling to chat and tell you how wrong you are.
We just try to chat with each other.
Right.
It helps a lot.
It helps a lot. Well, of course, the support system does have a major role, and as a clinician, it's better to be in contact with them as well. It depends on different conditions of life. But going back to this speech and what you are saying, I must say that the whole focus is that everything is coming from inside of us. And what I tried, the point I tried to make is that human being needs to stop somehow controlling the environment and changing the environment outside of us in order to bring that peace inside themselves. Unfortunately, I must say this is the disease of our society right now. It is the main problem happening in this world. I didn't have time to go to the other side of my speech for today, which was about the other system, meaning that what happens, that one tiny little problem happens in our life, we crush down. That I didn't go. I just went to once the other side. But the other side also exists, and that's exactly it. From what we know, when people think that what is happening outside of them can be controlled, therefore they can have that inner peace. I use my psychologist to control my environment and my outside. I use sleeping pill to sleep. I use all these drugs to give me this joyless pleasure, to have a moment of pleasure because inside of me there is a chaos and I am restless. I use drugs to enhance my sexual drives. I use surgery to change my appearance head to toe in order to bring that sense of satisfaction and all of the, meaning that you try so hard to change the outside because your sense of self, but in a different way, is being attacked. Therefore, that is the solution, and they try so hard, by the way, in this modern world, as we see constantly, is the source for suffering. And it can be coming only out of one very slight problem. But because they are in control, because they have everything, and they are living in so-called United States, they must fix it. And they use all the outside tools, which exist, by the way, because they need to be sold, to bring that peace into their life. And that, in fact, means suffering in this world. The main suffering is that. Thank you for taking me to that area that I didn't have a chance to go to, but I wish I was able to answer your question in a way. Yeah.
I have one small question. What is my role when I work from this conference outside? How I can be in peace?
Be in peace, right. That is the whole point, right. No one can tell you. That's the whole point. When the patient comes to you, and this is really the question, and people, of course, ask someone who is supposedly having a psychology degree, of course, what is my role and what can I do? The whole idea is this. The meaning that you find in every event that happens in your life depends on you and only you. That can be different than what I think is meaningful. And sometimes in one person and in one life it can be different from one moment to the other moment. But what you need to take, hopefully, from my humble presentation today is the need for that meaning. So do know that that need for searching and finding that meaning and having a general super mission as human being in life, in your own way, in your own world, at your own level, matched with your own values as a human being. Do know that need. But what is that meaning? And how can be applied to your moments of life? It really depends on you, and it can be quite different.
How to get that medication to work on myself?
I know, I hope I had it myself. Medication, I think, is really the values that we can adopt as human beings, and that those values need to stay beyond and above what we call as material values. Because the material values, wealth, name, fame, even respect outside, social position, all of those are the ones that are poison. We can keep them, but don't attach to them and find something beyond and above them. Then that saves us for the moments needed. Then you can detach from them way easier when you have something else to hold on to. Well, again, psychology, especially the scientific way of looking at psychology, they usually have a hard time with spirituality. or to have that sense of every spirit needs food, and this meaning is food for that spirit, the whole idea of Viktor Frankl and existential school of thought. They have a hard time to explain that scientifically, but they cannot really ignore the existence of that and the importance of that based on what they are seeing happening. For patients who do have those values and whose life and way of thinking stays beyond and above this material world, they can survive way better, at least by witness. But scientifically, as I said, not easy to define. Very small story always hits my mind when my patients ask these questions. Okay, what does it mean? What is it? What is the nature of that? How can I say that? How can you say that? A spiritual man goes to a scientist, asking the scientist, can you recognize the difference between, scientifically, between a drop of water and a drop of tear? The scientist says, of course, I can take it to the lab and I can look at it and we can easily say in the lab which one is the drop of water and which one is the drop of tear. The spiritual man says, okay, yeah, I'm convinced very well, but can you also say the difference? What is the difference between that, when the drop of the tear is coming out of joy and the other one is coming out of sorrow? Can you also tell me as a scientist? We cannot tell. But can you ignore the fact that it exists? And there is a huge difference. So, just believe in it, have it as a human being. We just feel that it exists and keep it very dear to our heart. And that would save us.
Thank you very much.